Hi, I'm Brian Miller, and I'm going to do a heart examination on my patient Jacob DeSantis here. So first, I just want to know overall appearance. I'm going to have him lay back at a 45-degree angle if I can. And I'm going to look at his fingernails and kynosis, look for any clubbing, which would report cardiovascular disease or COPD. Next, I would like to do the jugular venous pressure. So with that, don't have a pen light, but I'm going to use a flashlight on my phone. I'm going to have him turn his head to his left, and then I would use a ruler to go to his sternal angle, and then I'm going to look for the impulse at its highest on the jugular, and then I'm going to measure the degree difference from the sternal angle to that jugular pulse, and it should be lower than 3 centimeters to be normal. Next, I'm going to observe the chest for asymmetry, any abnormalities, deformity, and that could be, looks pretty good here, but you would look for indentation or outward of the sternal angle, which would be excavatum carnitum. Next, I want to do the epigastric or subxiphoid pulsations, and that would be on the aortic. And I would use my flashlight again because I don't have a pen light and know what the difference is there. And Jake's look normal as well. Next, I want the patient fully supine, and I'm going to look for apical pulse. And I'm going to have the light aimed at the left ventricle and have my patient slowly exhale and then hold that breath. And hold it. And I see Jake's as well, so he is good in that category. Next, I'd like to palpate, and I'm going to palpate for PMI, which would be the point of maximum intensity. And if I'm unable to do that, I could have him turn to his left side for a better position. And then I wanted to just note the diameter of which should be 2 to 3 centimeters of force, duration, and location. About the 5th intercostal space. And these look fine as well. And then next I want to, with the patient supine, so all the way back like he is, I'm going to palpate for thrills, lifts, or heaves, and all 4 of the valves. So aortic, pulmonary, bicuspid, and tricuspid valve. So start in the aortic, and then move to the pulmonary, and then bicuspid, and tricuspid. And his seem pretty normal as well. Then I'm going to percuss, and this will be with the patient seated. So if Jacob, you could face up and towards me from the camera. I'm going to percuss lateral to medial from the 3rd, 4th, and 5th intercostal spaces. And just noting the border of the heart. And that seems normal as well. Next, I want to auscultate. And this I could do in the seated position as well. And there I could note for any extra sounds or murmurs, which I haven't seen, or splitting of S2. And then I want to auscultate for the pulmonary valve with the diaphragm, and I'm going to have the patient inhale deeply on this one. So inhale deeply for me. And S2. And hold it. And that seems normal as well. And then I'm going to use the bell of the stethoscope now, and I'm going to have him just breathe normal and do a stethoscope over all the valve locations one more time. And there I would note if the pulse was louder at the cardiac apex, if it was going to be an S2, S3, S4 sound for any differences. And then lastly, I'm going to do some special tests. So I'm going to have the patient seated, leaning forward, and then I'm going to exhale and hold their breath. I'm going to examine, listen to the right second intercostal space with the diaphragm. And this is for aortic regurgitation. And that seems normal as well. Next, I could do the mitral valve enhancement and see if there would be stenosis or prolapse on that. So I'm going to exhale completely and stop breathing into expiration, and I'm going to hold the valve over the mitral valve. Exhale completely. And that seems normal for Jacob as well. And that would be my examination on the heart for Jacob DeSantis.